Welcome. Thank you for joining us this evening. For those of you that don't know me, I am Priya Bathija, founder and CEO of Nyoo Health. And for those of you that are not familiar with Nyoo Health, we are working to help improve access to health and healthcare for women, and doing that in a number of ways, one of which is through events like these, where we are bringing together sort of the best in healthcare experts to talk about different aspects of women's health. So I'm excited today to talk about fertility. Last May, I had the opportunity of sitting on a panel with Asima Ahmad, our speaker, and I was so impressed by everything that she is doing in her practice and at Carrot Fertility. And I think the most refreshing thing was that she is able to explain all of these complex things in healthcare and in women's health in a way that we can all understand, and we can get actionable steps to help us, address our hormones and fertility challenges as we move forward. So excited to have Dr. Ahmad join us today. And she is the co-founder and chief medical officer of Carrot Fertility, the leading global fertility and family building platform providing care for everyone, everywhere. As Carrot's chief medical officer, Dr. Ahmad leads clinical strategy, overseeing the company's expansive network and telehealth program, which offers access to more than 10,000 reproductive endocrinologists, urologists, adoption experts, mental health experts, OBGYNs, doulas, and midwives. In addition to her role at Carrot, Dr. Ahmad is a practicing reproductive endocrinologist and infertility specialist. She is double board certified in reproductive endocrinology and infertility and obstetrics and gynecology. She has earned a combined medical and public health degree from the University of Chicago's Pritzker School of Medicine and the Harvard T.H. Chan School of Public Health. Dr. Ahmad, I'm so excited to have you with us, and she will be speaking with Nadia Khan, who is our Nyoo Health policy analyst. In addition to helping plan these events, Nadia also researches all areas of women's health so that we at Nyoo Health can stay up to date, and we can share that with all of you. So Nadia, I'll turn it over to you.
Welcome, everyone. Thank you, Priya, and thank you, Dr. Ahmad, for being here. We're so excited for this conversation. Dr. Ahmad, if you could start by just telling us a little bit about yourself, your journey towards earning a combined medical and public health degree, and how that sort of influenced and drove your interest in fertility and family planning and in developing Carrot.
So excited to be here. I can't believe it was May that we met. I feel like I've known you for so much longer. But yeah, I'll jump right in. And if while I'm chatting, you think of anything else, Nadia, please feel free to interrupt me. I'm a first generation South Asian immigrant. I'm lucky to have had the best role models in my parents because they're so selfless, they're so giving. They honestly invested everything into their children. And early on, it started instilling in me this like desire to help others. And honestly, in the beginning, I wasn't really even sure how I was going to do that. But I'm like, okay, like this is a good feeling. I feel like I want to do something in my career around this, though secretly I wanted to be a choreographer or something. This was also something that I had in mind. I grew up in Chicago and also had like the firsthand experience of, in the school and social setting being normal and overnight being labeled as not normal or different. It was around the time of the Gulf War. So I realized how similarities and differences exist and how you can choose to use them as a way to unite us or separate us. And when it comes to like women's health care, now people who know me have heard this story before, so I apologize if you've heard this story before, but I think it's really, really important because this was one of the key things that drove me towards women's health. Is I had this aunt in Pakistan. She's actually my chachi, so my dad's brother's wife, who I didn't actually spend so much time with, but the small amount of time that I did, she had such a strong impact on me because she was one of the kindest people that I had met and just such a sweet, beautiful person. So she delivered her first baby in a hospital, and unfortunately, they were told that the baby needed additional oxygen. The question is like, was it a supply issue or was it more like a financial thing? Because over there, you would have to pay for care before you could start receiving it. And so they weren't able to provide higher level care to their baby and had to hold their baby until it passed away within a day. And after that, she lost faith in the system and didn't want to deliver in a hospital again. And she had multiple pregnancies. I have one cousin that survived. Unfortunately, she suffered through multiple stillbirths. She didn't receive any formal prenatal care. She would deliver at home with people around her area that had helped other women deliver their children, but not like that formal training. And with her last delivery, after she delivered the baby and realized that it was not living, she just said, she's like, why does this keep happening to me? And then started having a postpartum hemorrhage. They didn't have a vehicle, a reliable way to get her to the hospital because it was at a distance. And so, like, could they use a bicycle for primary mode of transportation? They had to go find a vehicle on the way to the house. It got, like part of the wheel fell into a little ditch. They had to get it out of there. By the time they got her in the vehicle on the way to the hospital, which was like a 30-minute drive, she unfortunately passed away on the way there. And it's such an unfortunate story because a lot of the things that happened to her, had she had the resources in place, whether it was a financial thing, an educational thing in terms of like just being educated on prenatal care and like what she should be doing during the pregnancy to reduce the risk of these things. At the end of the day, it was all something that was teachable and preventable, right? And so, and it's not just that this thing happens in a small village or a small town in Pakistan, it happens everywhere around the world. I mean, the United States, we have one of the highest maternal mortality rates of developed nations. So this is a global issue. And that was what made me decide I also wanted to focus on like the larger picture, like affect more lives. Even though I love that direct patient care, like I was like, how can I impact more lives? So I thought about different ways to do it. I, during medical school, thought about doing an MBA and MPH. And in the end, I decided to do the MPH and focus on global health. And it's funny that I was in Boston for them. That's actually where I met my husband. So honestly, everything happens for a reason. But some of these challenges that I've faced help me value my differences and those of others as an asset and help me become more resilient and honestly added the fuel to the fire towards my life goal, which, I realized over time and has become improving access to care for people across the globe and particularly for women.
Thank you for sharing that. I think for so many of us, our family histories and stories play such a big part of what we want to do. And I think that was a really great story. Thank you for sharing that. I want to dive into a topic that I know you've done a lot of research on, which is hormonal health. Could you speak to how hormonal changes impact our health and well-being across our lives, particularly as we age and go through transitional periods in our health?
Yeah. I mean, honestly, we wouldn't be sitting here functioning if we didn't have hormones. The hormones are affecting us from before our birth to our very last breath. For example, like when you're in utero, when you're in your mom's uterus and you're developing, it's the presence or absence of hormones that affects the phenotype of your genitalia, meaning like how will your genitals look from the outside? I mean, that's just one example, but like even that early on, like it's affecting our development and how we look and how we can function moving forward. It affects our skin, our hair, our growth, our metabolism, our mood, literally everything. So I think that, and again, look, I could totally be biased because I'm a reproductive endocrinologist, but I truly believe that they are key to our daily functioning and our well-being, both from a physical and from a mental health standpoint.
I think there are a lot of parts of hormonal health that feel sometimes confusing and unclear. In your work as a practitioner and at Care at Fertility, what aspects do you think are most commonly misunderstood, and why do you think it's important that women better understand those aspects of hormonal health?
I think people are starting to value the role of hormones. The masses are jumping on the bandwagon, but not everyone has a full understanding and not everyone's an expertise in hormones. And I think there's this misunderstanding that, like just in life, with hormones, there's not going to be like this quick fix. So what works for one person as a solution to alleviate their symptoms or whatever their issues may be related to the hormone, it's not going to work for the next person. And what worked for you years ago might not even work for you today or tomorrow. So you have to understand that it's just not like slapping a band-aid on that like fixes everything for everyone. And I think that that's something that I've started to see as people speak about certain things around hormones for menopause, for instance. But I think everything needs to be personalized to that person and their body. And your body, it's like continuously going through changes depending on your lifestyle, your genetic predisposition to things, and your age. So you have to constantly work towards your health, and that includes managing your hormones when need be.
Yeah. I feel like I see more in the media a focus on fertility. I've like noticed that being talked about more. Could you talk about the connection between hormones and hormonal health and fertility?
The best way to describe this is that your hormones are all like they're all interacting with one another. Even if they aren't focused on that same primary organ, they all interact. So like when I think of this hormone that comes from your brain, it's called FSH or follicle stimulating hormone. I automatically think ovary because I have follicles inside my ovaries and that's where the eggs are and that's what it's influencing. Or if I think of thyroid stimulating hormone, I think of thyroid, your thyroid gland, and how it's affecting that and it's stimulating the production of thyroid hormone. I always try to find a good analogy for this. And I think it's like being on a highway with cars moving at a fast speed, and each car has its own destination and its own pathway. But if one swerves or moves into another lane, the car in the other lane is either going to get hit and move off its original path, or it's going to need to slow down, and the time that it takes to reach its destination will change. So, in that way, hormones are indirectly influencing one another. So, I use the example of thyroid stimulating hormone or thyroid hormone, it affects your fertility. If that's off balance, if there's too much or too little, it can affect your cycles. It can actually affect your pregnancy. People who have thyroid issues can sometimes have increased risk for pregnancy loss. So that's one of the hormones that we look up when we're looking at fertility or recurrent pregnancy loss. If you think of testosterone, for instance, sometimes people start taking testosterone injections, and in our body, there's these, we call them feedback loops, and it can be a positive feedback loop or a negative feedback loop. So basically, like a hormone can be sending a message to your brain, which the hormone from your brain sends a message back to that organ. And so when someone takes testosterone injections, that's called exogenous testosterone. It's testosterone that was produced outside of your body and is being injected in, but your body can't tell the difference. So your body's like, wait, I'm making enough testosterone, so I probably need to decrease that signal that's coming from the brain down to the testicle. So I don't need to make that much. And in that process, the person's own testosterone decreases that they're making in their own body, and also the sperm production. So again, it's all connected. And the same thing happens with like birth control pills. What do birth control pills happen? They have estrogen and progesterone, and you're introducing that hormone, and basically that keeps you from ovulating. It's when you come off those pills that you bleed, and that's because you're removing the hormones that build up that lining, and now you're shedding that lining. So those are a few examples, but again, they're all interconnected, and just because it's not a hormone that's typically directly influencing a particular organ doesn't mean that it won't influence another organ.
Yeah, that makes sense. I think that highway analogy helps. It's like a reactive system. And then I kind of want to move into talking about fertility and family planning. In your practice, what challenges do you see most commonly that women are facing relating to the fertility and family planning?
Well, for generations and years and years and years, I mean, the stigma,
Yeah.
the culture of blame, the culture of silence. There's so many people that don't even share that they have infertility
Mhm.
because of the shame and the blame. And in some cases, and I can say this being South Asian and Muslim, like sometimes we would see that the male partner would find a new wife. Like it would either be wife number two or just a whole new wife altogether because it was always the wife's fault. She couldn't get pregnant or she couldn't bear the son. And we've now started to shift away from some of that, but it still exists to a certain degree. So I think it's important to continue educating people about the role of both partners when it's a heterosexual couple that's trying to, have a baby together. Advocate for that full workup, meaning for both the male and the female, and discuss all the treatment options because in one way or another, you can build a family. It might not be that original path that you had envisioned, but there are different ways to get you there.
Could you talk more about advocating for yourself and the best way you think that women can do that?
It's complicated, and that's why I'm not giving a straightforward answer. I think that it just depends on where you live. There are still parts of the world where you may have the education and understanding that it's not just on you, but for local culture or other reasons, like you know that you can't speak up because the blame is still going to be placed on you. And I think that's one of the most challenging things. I think in other cases, when that type of culture or environment doesn't exist, I think it is important for women to speak up and say, hey, like, this is something that can come from both the male and the female side. I'm willing to do the workup on my end, but I would really encourage you to check yourself as well, because in 40 to 50% of cases, there can be a male factor component.
And in addition to that, how can we do a better job of providing women with the relevant information related to fertility? Because there's so much out there and we sometimes don't know where to go first.
Yeah, I mean, so that's why we created Carrot Fertility.
Right.
Like, you know,
That's
for a
my
lot
next
of
question.
And actually, that's also a complicated question because, as you know, there are websites that I could refer you to. Parts of those websites are not available currently. So it is important to have a reliable source, and there's a lot of misinformation and disinformation out there. ACOG is a really good website to go to. They have a lot of stuff about, pregnancy, and especially if you have like high risk scenarios or like pre-existing conditions. ASRM's website also has a lot of information around fertility. So if you're in the United States, those would be two places to start. Obviously, if you have access to a platform like Carrot, then you have everything at your fingertips. And you can also log in and talk to people live 24/7 on those topics as well.
Yeah, I wanted to shift to talking more about the work that you're doing at Carrot. How did your experience working as a practitioner and researcher influence your decisions as you created Carrot? And if you want to talk about kind of what inspired you to be a co-founder.
So, one of the things that I was seeing as a practitioner over and over again was that people had limited access. And one of the biggest barriers they were facing was financial, because most people did not have coverage for infertility. So, they were taking out loans, they were borrowing money, some of them were mortgaging their homes, they were moving back in with their parents. Some of them were delaying treatment to be able to afford treatment financially, and some of them would not be able to do it altogether. And all of those situations were suboptimal. I think another challenge, and we kind of touched on this, was that there's a lot of misinformation and disinformation out there. I think a great example of this was a patient that I had. So in fellowship, I was at University of California, San Francisco, and we had a special PCOS program that people would actually fly in to see us for. And I remember telling a patient that she had PCOS, and we were talking a little bit about treatment options, and she started crying. And I was taken a little bit aback, because usually when we're talking about treatment options, people are asking questions and wondering, like, okay, does it have to be oral medications or injections? And her husband put his arm around her, and he's like, I told you you needed to see another doctor. And she told me that she was with the same doctor since she was, when she started having her periods as a teenager. And when she was told that she might have PCOS, like, the provider told her, like, because of this, you will never be able to have your own children, which obviously is not true. And so it's not only that this misinformation or disinformation is at the hand of the provider or a family member or a friend, but like we kind of talked about, like, oh my God, internet, social media, everyone's an expert apparently. So it's tough trying to figure out on your own what's reliable and where you turn. And the other thing was geographical barriers or rural access. Because of that, people were not able to see a physician when they needed to. So there was delays to care and work-life restrictions. I think, Bria, we were just talking about this before we started. Everyone's busy. You can't take off time. Or if you do, because for an IVF cycle, you have to take off multiple days over the course of 2 weeks typically, there might be that fear that there's an invasion of privacy. And so that's where we thought more about the role of telehealth being available to help get people to where they needed to sooner, but also help educate them even before they walk into the clinical setting. And so all those things together, we reviewed this, my co-founder and I, and that's how we thought of developing Carrot.
Yeah, and you touched on the telehealth portion. You talked about how with Carrot Fertility, you can access an expert at any time. Can you talk more about why you think telehealth is important in general, and especially with care at fertility, and how that improves access to healthcare?
Well, I think a great example is the pandemic, right? We just realized the value of telehealth. I think in the clinical setting, I wasn't allowed to do virtual consultations with patients unless they were 3 hours away or further. Otherwise, they would have to drive in. So it helps people get the care they need when they need it. So sooner, fewer delays. And honestly, one of the things that I've seen that I think is very helpful, because, I do have some single intending parents who are patients, but I do have many that are with a partner. And when you're doing that treatment together and you need to be on the call together, it's hard for both people to take that time off for work. But what telehealth lets you do is one person can be in their car, one person can be at their office. I mean, they can be in different locations, log on quickly and get right back to work. So it's actually helped with, like, even from the clinical side, with follow-up visits instead of getting lost to follow-up, and compliance. And we actually, in addition to the telehealth and education support that we provide through Carrot, and we've been doing from day one, we actually recently launched a virtual clinic for menopause. So you can log on, speak to a certified menopause provider, and get that prescription or, medical plan in place for whatever you need to do to alleviate your symptoms. Because again, menopause is one of the places where we felt that people were struggling to find the right provider in a timely fashion. And again, sometimes there are limitations to finding somebody locally. So this allows them to get that care, do it confidentially, and do it in a timely fashion.
Yeah, that's awesome. I feel like the physical barrier is also sort of like mentally hard to get around for people as well. And then kind of shifting gears towards research, you've published research in academic literature covering a wide range of topics. What research do you think that's being done now is most important for women to know about, or kind of what research do you think we should be doing now?
To start, we just need more of it. We need more time, money, and resources invested in women's healthcare and research. But honestly, I think all research is important. The smaller studies, the larger studies, because the more studies we have, the more we can look at that data together and compare them and make better decisions for patients and for people. And that means also just including different populations in your studies of different backgrounds, genetic makeup, lifestyles, different parts of the world, because we use this example, the way that a heart attack may present in a older white male is very different than it's going to present in a female, or even in a gentleman who might be of South Asian or a different origin. And so you need to study different populations to understand how different diseases present, and then how those treatments will affect them in a different manner to find out what might be most effective for them. So I think we just need to keep investing more in women's health, and there's data to show that there's a lot of work that needs to be done there.
Yeah, I know more diverse studies are being done, but there's always so much more progress we need to make. And I also just want to let everyone know if you have questions, feel free to throw them in the chat. I'll ask you a couple more before we wrap up. What gives you hope as you continue to do your work? And with Carrot, what gives you hope every day when you are working on it?
Well, honestly, every time I'm playing a role, like whether that's big or small, and helping someone reach their personal goal, that's honestly what drives me. So whether that's a message from a Carrot member saying we help them grow their family through adoption, or patients that I've had in the past who I no longer currently take care of, but they keep in touch with me and send me updates about the birth of their child or the birthday of their child. I mean, I feel so lucky to be in the profession that I am. Actually, I was thinking of something along the lines of the research that you mentioned. Again, like, I think that there's a lot that needs to be invested there. What I'm actually currently interested in is learning more about ovarian aging, because that's a reality that still exists. Like, that's not something that we can bypass yet. And there's research being done to see if there's something that we can do to delay ovarian aging, and different methods of fertility preservation, or even things like in vitro maturation, which can help reduce the burden and the cost when it comes to fertility treatments.
What do you think is the most important issue in women's health right now? I know that we should be researching everything that we can, but what do you think? Yeah, what do you think is the most important issue in women's health right now?
So, like I said, women's health, I think sometimes people think of it as reproductive health. Women's health is everything to do with health. It's not just the reproductive part. I think it's important to look at our life stages together and understand how to prepare for and optimize our health for every stage of life. So, taking more of a proactive approach and not a reactive approach. And I think that's how a lot of the way that we deal with our health is. We don't try to fix something until it's completely broken and it's impacting us. Like we should be prioritizing preventative methodologies. And this is just like on a day-to-day basis, like what should my lifestyle look like to optimize my health now, as opposed to like getting heart disease and then going back and adding the medications and making those lifestyle changes later. So I think educating people on the risks that are going to increase over time is important. So example, when someone's postmenopausal, their estrogen levels have dropped. So that affects their cardiovascular health, that affects their bone health. People should be educated about that beforehand so they know how they're going to make lifestyle modifications in advance to help reduce those risks. Now, whether that means that somebody's going to start doing strength training and weight bearing exercises or take estrogen or some hormones, I mean, that's an individual decision. But I think like knowing all that before is really, really important. And I think most people aren't educated that way or aren't exposed to information in that way. They're usually looking up things while they're in that moment or after it's happened.
Yeah. I've seen some articles lately that do focus on like preventative care and like core strengthening. It's just something that you never think about until you read that and you're like, oh, core strengthening.
Oh yeah, I totally didn't think about it by core until I had four kids, and I was like, where did it go? Like I thought, what's the core?
Yeah. I'm just glancing at questions coming in. Given the current environment, how do you think we will move forward with women's health?
I mean, I would like to say that we're headed in the right direction and that we're openly speaking about it, but then on the other hand, I have seen some things move in the opposite direction. I hope that we continue, all people, not just women, all people continue to advocate for women's health, for women having the autonomy to make decisions for their own selves regarding their own bodies. And I hope that the people that are at the level when it comes to making new laws, rules, and regulations understand the value of that and continue to support women so that they can work towards creating a situation where they can pursue forms of healthcare that are best for themselves and whatever journey they're in at that time.
What advice do you have for those of us who want to support the women in our lives who are experiencing infertility and advocate for them, not just support?
I think the biggest thing to start is to let them know that you're there for them. Sometimes they feel alone and that they don't have anyone that they can reach out to regarding it, and just being there, just listening. Don't like go out and give unsolicited advice, like please don't do that, but just being there and listening and trying to understand what their needs are in that moment can go a long way. And sometimes it's not even saying much back. Sometimes it's also just like if they're in the middle of infertility treatment, being available to provide support with their daily tasks. Like if they need to get groceries, get that. If they have to stay home, or let's say they have to go to their appointment and they can't pick up their kids from school or something like that, or, like because maybe they have secondary infertility, then you help them with those things. Most people mean well when they say things about, just don't think about it and you'll get pregnant, or if you keep trying you'll have a successful pregnancy. I mean, I would recommend staying away from things like that.
Who comes to you as a reproductive endocrinologist and OBGYN? Like everybody or people just trying to get focused on fertility?
Well, it honestly depends on how you've set up your practice. Historically, reproductive endocrinology and infertility specialists, they would manage infertility, but they would also do a lot of reproductive endocrinology, meaning just management of like things like polycystic ovary syndrome, perimenopause, menopause. And they also used to be the minimally invasive surgeons of the day. So when you had a case of endometriosis that you need to be managed laparoscopically, like they would be the go-to surgeons. Generally, most REIs now are focused primarily or mostly on the infertility side, But honestly, everyone's practice is different. So if you are somebody who has a hormonal issue, like you're going through perimenopause or menopause, like you could reach out to REIs in your area to see if they help manage menopause care. One of the things Carrot does is it helps people, go straight to the network and go straight to the menopause provider and not have to make those phone calls on their own, so that you can limit the amount of time that you're jumping from provider to provider. But there are still some REIs that do hormonal health care and do surgeries and all that.
And then we can go back to Carrot Fertility for a moment. Is there anything that you're thinking of in the future for future developments, or do you see it changing in any ways in the future?
There's definitely some really fun, interesting things coming up soon. I just can't say everything yet, but hopefully you'll find out soon enough.
Yeah.
But we try to keep our finger on the pulse when it comes to emerging treatments, technologies, and methodologies of care delivery. I think that we're always excited to learn from our customers and find ways to make the platform, more effective for our members as well. I mentioned that we have great things coming, but like again, we recently launched the telemedicine for menopause, so we were really excited about that.
Another question just came in. How does Carrot Fertility support patients from a place of cultural competence?
So that's actually one of the things that we've focused on really early on. So Carrot started off as a global company, and you can just see from like state to state how much healthcare is delivered differently, especially for women's reproductive health. So just imagine what that's like on a global level. So we've understood from the very beginning the nuances when it comes to how culture, how religion, how faith, how other background, or just, where you're located geographically can play a role in what types of care are available and what types of care are considered acceptable. So I think cultural competency is used in, many different ways, but I would say that when it comes to the role of your culture or your faith or your background or your language, whatever it may be, even gender or gender orientation, like we have focused on that from day one, and we have a lot of experience in that space to make sure that you have a well supported and honestly the best possible type of journey through whatever journey that may be in your fertility and family building.
You guys are doing such valuable and important work, so that's awesome. I'm gonna wrap it up and pass it back to Priya. Thank you so much, Dr. Ahmed, for speaking with me and providing all this valuable insight. It's been really great to have you.
It's been so much fun. It went by really quickly.
It really did. Thank you so much for joining us and being a part of this, Asima. It is always great to get to chat with you and hear your thoughts on all of these issues. And I always learn so much. And even though I haven't had sort of a fertility journey, it is always helpful to hear about sort of how our hormones are impacting us, and to know that that starts when we're like a fetus in the womb. That was the first time I learned that today. So thank you for being with us. Nadia, thank you for moderating the conversation. Thank you all for joining us tonight for this conversation. Of course, we will share the recording when we have it to all of you and those that weren't able to attend. And I hope you will consider joining us for our next What's New conversation. We only have 2 left in the series before we wrap it all up. So our next event is on March 20th, and it is titled What You Need to Know About Your Pelvic Floor. And we will be joined by a pelvic floor therapist and expert in this space, and she will cover everything, including what is your pelvic floor and where is it in your body. So we hope you will join us for that. And thank you again for being here tonight.